it's 10:45, so let's go ahead and get started right away to make sure we have good use of our time and that we have the time to use, because I know we have a lot of content to share. And I'm so pleased to be facilitating this last session today. It's the last session of our conference too. We've had so much good content being shared, and this one is going to be no exception. I'll introduce our two presenters in just a moment, but let me just say that, so this session is really just going to be a wealth of information from these two speakers who we have the honor of joining us. They both have a tremendous amount of knowledge and experience with coverage in our nation, really, and with issues involved in enrollment assistance. So this session will be a great way to round out the conference, summarizing how this year is different, as you are all very well aware, and in definitely some ways more challenging, while also sharing a great deal of new information and messages to help inspire and ground you as we step forward into open enrollment. But I do want to make sure you all remember that, and again, especially this year, enrollment is a year-round sport. So applications for Medicaid are considered at any time, and life changes open up special enrollment periods for the marketplace, such as the FEMA SEP, which I'm sure you're learning about. So even if your position doesn't allow you, or you don't see many consumers, remember that Covering Wisconsin and our affiliates in the state are here every day to be a referral, and you can always at least be on the lookout for those who need help and be proactive in continuing to raise awareness. So with that, let me introduce our speakers. So first, we'll have Tara Straw. Tara Straw is a senior policy analyst in the Health Policy Department of the Center on Budget and Policy Priorities. She works on a variety of health issues, including enrollment, premium assistance, and health insurance marketplace operations under the ACA, the Affordable Care Act, as well as tax-related healthcare policies. Tara received a master's degree in public policy from American University and a law degree and LLM in taxation from Georgetown University Law Center. And then following Tara, we'll have Karen Pollitz. Karen is a senior fellow at the Henry J. Kaiser Family Foundation. She works on the program for the study of health reform and private insurance, tracking implementation of private market reforms with a focus on consumer protections. Prior to joining Kaiser, she worked at the U.S. Department of Health and Human Services on national health reform, both from 1993 to 97, as well as 2010 to 2011. She also directed research in private health insurance at the Georgetown University Health Policy Institute. She has a master's degree in public policy from the University of California at Berkeley and a BA from Oberlin College. So with that, I will turn it over to Tara. And I think, Tara, you're able now to share your screen.
Okay. There we go. Thank you so much for inviting me to come and talk about this. I have to admit, it's going to be really difficult to follow up on the last session, which was really, really substantive and interesting and so useful to everyone, including to me. So I just want to thank those speakers for giving so much information, and I'll do my best to give you some more information that's useful and really actionable for them for Open Enrollment 8. So there are obviously a lot of challenges in OE8, and I'm going to talk about some of those. And then Karen, I think, is going to remind you why you are the exact people to face those challenges and why your role is so vital in making sure that people have health coverage and health care. So some of the challenges that you're going to experience this year is getting people in the virtual door, whether it's phone assistance or some kind of video assistance. It's, it can be daunting, I think, for consumers to know what their options are. We know that people can easily get overwhelmed, especially with something like health insurance. which people all know is already complicated. There are also concerns about getting accurate eligibility determinations, and that's because so much about 2021 is going to be really, crystal balling what the year is going to look like. And we also have the idea of, potential legislation hanging over our heads, and what does that mean for instance, how much unemployment someone gets. So we're going to talk a little bit about that. And also just a touch about APTC reconciliation, because these issues are already coming up. And I'm sure that you'll get some questions about that. So just a little look at and discussion about who we can expect to enroll during this open enrollment. This is what your open enrollment looked like last year. And this has been pretty consistent across the years that you have and everyone around the nation. This is pretty typical for other states, but most of the enrollees are active re-enrollees, which is obviously what we really encourage, especially this year, and we'll talk about the reasons why that's the case. There's some percentage of new enrollees, and we would hope and expect that percentage will go up, since there are more people who have lost employer-sponsored coverage or who are on COBRA but maybe cannot afford it. And then there are the automatic re-enrollees who, are a little disengaged maybe, or we can, look on the bright side and say that maybe they're really happy with their plan. The problem is that they may not be getting the right level of financial assistance, and so that's a challenge getting that right. So in summary, I think that you're going to see possibly new Medicaid and Marketplace shoppers. I think that you'll see more people who have very complicated income situations because they just don't know what their 2021 looks like. And I think there will be a population who enrolled in COBRA initially because, when a lot of people lose their jobs, they think, oh my gosh, I've got to maintain health insurance, and they're thrown this option of COBRA. And I think many people take it up and then realize later they can't afford it. And those people are eligible during open enrollment or during any special enrollment period that they qualify for to make a new choice and to get into the marketplace. And certainly, if people are eligible, they can get into Medicaid at any time, as Allison said. So I'm going to talk a little bit about messaging, and I'm going to start with the caveat that I am not a messaging expert. I listen to the experts, and these are the messages that seem to work with people. There are a couple of messages that have changed just a little bit, but generally it's what we've always been talking about. So it's important to keep that in mind, that the messages that you've used in the past are still what seems to work today if you look at focus groups and polls and what have you. So the top message that people want to hear is on affordability. That low cost or free coverage is available. An astounding number of people don't think the ACA is the law anymore, don't know about their eligibility for Medicaid, and don't know about the idea that there are sliding scale premium tax credits available. If you're talking about different income brackets, so if you say, if you make under X amount of dollars, you may be eligible for Medicaid, you might consider one suggestion was to consider using weekly income instead of annual income, or in addition to annual income, because it's a little more accessible to people. They know what their current weekly income is, but they may have a lot of trouble projecting for the year. Just a general reminder that financial help is available. In 2020, 70% of marketplace enrollees in Wisconsin could get a plan for $50 a month or less. People like hearing those numbers. One message that also tests very well is that coverage gives you peace of mind, and it's there. The caveat that COVID messages are really hit or miss with consumers. Some people see them as scare tactics, and so they don't necessarily bring people in the door. So to the extent that you're thinking, oh, we need to really change things up this year, I don't know if that's true. Now, obviously, some people will respond to messages in different ways, and the COVID pandemic, seems to continue to shift. And if if things do get worse during flu season, there are all of these variables. But just the idea that the COVID messages that have been tested sometimes seem like fear-mongering to people. You want to reinforce that coverage covers doctor's visits, preventive services, prescription drugs. A note that talking about a COVID vaccine, people are very cautious about that. And so, I don't know that you would want to get into that level of detail about, the potential for someone to qualify, or the potential for preventive services and vaccination services to cover a COVID vaccine, because people seem really kind of tepid about, no one wants to be the first. And obviously the fact that you are there and free help is available virtually or by phone. And of course, it always works to underscore open enrollment timelines and deadlines. People like a deadline. We're going to talk more about eligibility determinations and how difficult those might be this year. If it was incredibly hard to get a 2020 income right, we're still, we're going to figure out how close we got when reconciliation happens. But 2021 might be even harder, and that's going to be a challenge. Of course, people don't know what their income will be because many people are looking for jobs or hoping for more hours at their jobs, have unemployment. But also, there are potential federal law changes. What if there's another federal unemployment boost? And the more sources of income that people have, the harder it is to figure out, because you're tracking a lot of things and you are just adding more variables to the mix. And so it's really important that that people walk out the door knowing what their guesstimate was, because that could change a lot during the year. Prepare for more data matching inconsistencies. And that's because 2021 income projections might be significantly different than 2019, which is the year that income is compared to. And of course, because of all the variables this year, we need to emphasize the need to report income changes. A little primer on unemployment insurance, because if you're like me, you maybe know a lot more than you did a year ago. All unemployment income or insurance is counted as income for MAGI determinations, and this includes the weekly base UI, extended benefits, extension of UI for up to 39 weeks. But remember that that only goes right now up until December 31st, 2020, which means you're not necessarily looking at the projecting UI based on the current UI. Expansion of UI to new population, so maybe people who are self-employed. And then there was the executive order about lost wage assistance that expanded, or that raised the UI amount by $300 for a week temporarily. And that lost wage assistance is excluded for Medicaid. There was also that $600 per week federal supplement that was also excluded for Medicaid, and that ended in July. So one of the complications is going to be people hitting their caps on eligible UI weeks, and that will likely happen in the spring. But the variables, who's going to get UI, if there's legislation, how much will they get? When would legislation be passed? If it's passed after someone has already come in for open enrollment, they might need to make even some early income projection adjustments. This is not my table, it's from other very smart people from my group, but it did give me a sense of what UI might look like. And so if you look at, for instance, the bottom picture there, I think that this will be a very common scenario. A worker lost a job in spring of 2020. The state has 26 weeks of regular UI, which I believe Wisconsin does. They have 13 weeks of this additional federal assistance, and then 13 weeks of what's called extended benefits. And the extended benefits happen after the federal assistance. And so you can see that regular UI would have expired in September. and then you go into the federal supplement UI, which would go to the end of December right now because that ends the authorization. And then you have the extended benefits. So I think you might be looking at a significant number of people who are in this situation whose benefits would end in the spring. But it's really hard for people to know when benefits are going to end. It's going to be very hard for you to calculate. I wish I had more solid advice on that, except to say that the UI benefits that people are getting right now may be significantly curtailed for 2021. So definitely don't assume that it's going to extend through 2021 unless we have legislation that changes those rules. We're going to talk a little bit about some of the new features in healthcare.gov. And if you've been doing applications recently, you may have seen this. Some of this is just a reminder, and there are many, many people on this call who don't need it. But we'll go quickly through a few screens. You can see I did a little application for myself. We have first, it's really important to get the monthly income right. And the tendency for people is for some assisters, is to worry more about the annual income than the monthly income, and to sort of try to make the monthly income and the annual income match. So, have the annual income divided by 12 and call that the monthly income. But you've really got to separate them out, and healthcare.gov has made it a little easier this year. So let's say I have unemployment, I have $375 a week, which is about the average, and I think pretty close to what Wisconsin has. There are different options of how to enter it, but one thing I just want to highlight is if Congress does pass another weekly federal bump, if it's the same as the $600 benefit, you will want to make sure to enter it as a weekly benefit. Because if it's entered as a weekly benefit, for the period up to the end of July when that benefit was live, healthcare.gov was doing the subtraction of the $600 behind the scenes. And it wasn't necessarily clear to people that that was happening. And so the monthly income looked wrong. It looked too high, but that math was happening behind the scenes. And I think they would turn that feature on again if there was another weekly bump. And then the application asked about yearly income. And like I said, the yearly income and the monthly income can be very different. They don't have to be a multiple of 12. So, they've tried to do, they've multiplied by 12 to get a yearly income. For many people, especially this year, that's just not going to be correct. And so you can say that income is hard to predict and make a new estimate, but there are some new tools, or at least one new tool that helps you make an estimate. And I think it's a big improvement over what they've done before. There is a new worksheet that lets you enter income sources and expenses, and it actually does a much better calculation than has been true in the past. And so you can see there are drop downs with different income types. You can put in the amount, and you can actually put in the start date and the end date. The problem is that in the past, healthcare.gov has assumed that even things like UI continue all year. And there had been a feature where you could put like what the end date was, but frankly, the program didn't recognize that. So even if you put an end date, it just wasn't calculating correctly. And many people that we've talked to about the frustration of that. This one actually works, which is a great thing. And at the end of the process, you will get a worksheet that you can print out, a PDF, that goes through the amount of income someone has, their sources of income, and the net expected income for the coverage year. And so you can go back to that first screen and put in what the calculation is for the net expected income. And I think this is a great tool for people to walk away with, because then they know, as I said earlier, they know what their guesstimate was, which isn't always going to be, which people just won't remember otherwise. You also have the option to enter monthly amounts in this kind of worksheet. And so, this kind of works better for calculating income for an SEP, because it's going to be hard to estimate monthly income as a projection, but that option is there too. And then we'll get a review screen. They've taken out a few confusing screens, which is great, but you'll get a review screen that has the current monthly income and your expected yearly income. And of course, monthly income will determine Medicaid determination, your that helps people estimate self-employment income, which is particularly, it's because many people don't recognize themselves as self-employed. If someone is doing odd jobs or they have some kind of other employment that isn't regular employment. I'm sorry, I just saw a message that I'm breaking up a little. I'll try to talk louder. So this is a portion.
Oh, sorry. This is Allison. Maybe just turn off your video. We were having this trouble earlier today too. I think there's stuff going on with the internet. Sometimes that can help just focus the bandwidth on the audio. We'll see if that works. Thank you. Sorry about that.
I might need help doing that.
Yep, Tara, actually, I just turned it off for you, so you should be all set.
Oh, perfect. Thank you so much for the help. So we have this self-employment tool. On the front, you have income. On the back will be expenses. Don't worry about all the fine details on expenses if you're making a projection, because people just won't know them. But they might know big picture, the really invest expenses that they have. This is also useful for people who have self-employment income, but also have a data matching inconsistency and need to justify what their income is. Some kind of tool like this can be helpful to help people sort of streamline and really explain what their income and expenses will be. More on data matching issues. As I said, the 2021 income is going to be measured against 2019 income for reasonable compatibility, but 2019 was a very different year potentially for people. And so we can expect that we might have more DMIs this year, which of course is just another step for people to get through before they can make sure they can keep their subsidy. So the applicants awarded subsidies based on their attestation, but they have to provide documents to verify their household income. And either because there's no data income no data in the data hub about their income, or because, and this is a mouthful, because their attestation is 25% and $6,000 lower than the data available in the hub. So what really that means is that if their income, the income they project is significantly lower than 2019 income, then they may have a data matching inconsistency. So more DMIs to resolve. You might think about that when you're actually having the first interaction with a client. Maybe ask them, okay, so you're making this estimate. What's the estimate based on? And maybe anticipate in some cases that there may be DMIs, and start that conversation about how you would justify that. Some common reasons for DMIs are a change in a job, hours of employment. These all sound like COVID, like sort of COVID red flags. Irregular freelance or self-employment income that varies, and things like one-time income, such as IRA withdrawals, which sometimes people do if they lose a job and need cash, but also retirement cash outs. And these are a little tricky because sometimes low-wage workers are automatically enrolled in some kind of retirement savings plan, and they may not even know it. But when they leave their job, unless they have a pretty significant accumulation of money in that account, the employer just writes them a check. So they're not even necessarily, I don't think, told about rollover options or anything complicated like that. They just get a check. And consumers don't necessarily know what to do with that check, but it is taxable income. So they'll need to record things like that. And of course, people need to report changes that will impact the APTC. They need to report income and household changes, because if the projected income is too low, they face potential repayment. If it's too high, they might miss out on Medicaid or CHIP eligibility. They might miss out on getting a higher APTC that can make premiums more affordable up front. Or of course, on the other side, they could get a higher PTC at tax time. There are some tricks to reporting mid-year income increases, and I don't know how obvious these are to assisters. They're certainly not obvious to people who do their application on their own. The rule is a little complicated, but hopefully this example will help. In healthcare.gov, the APTC is calculated based on the new income, but they don't factor in what APTC was already received. So an example of that, at the start of the year, Malcolm's APTC was $200 a month. He reports income increase in September, so he gets a new job or he's brought back to work. And that's after he's already received $1,800 in APTC based on his prior estimation. So based on this new income that he has, this higher income, he's only eligible for $1,200 of APTC for the year. And the healthcare.gov is going to calculate that as $100 a month for the rest of the year. And you can see the problem with this because he's already gotten more APTC than he's entitled to. He's already facing repayment, and healthcare.gov is giving him more. So this is a case where Malcolm is going to need to reduce the amount of APTC he takes to 0. And so if you're really going to try to get the amount of APTC right, and of course you all do try to do that, you kind of need to do the math on your own, which is quite complicated, to know sort of on the slider how much APTC to take. And just a reminder about the repayment limits. These change every year. For people who are under 200% of poverty, a single person will pay back $325 if they received excess APTC, and any other kind of tax filer will pay back $650. And as you know, people who have income above 400% of poverty have to do a full repayment. So if you have someone who qualifies for APTC, but they are just hovering at that line, you really have to explain to them that they may be liable for full repayment, so they can either prepare themselves or decide that they're not going to take APTC up front, but they're going to cross their fingers and try to take a premium tax credit on the tax return and get the full amount there. We have another tool on this. This just brings together some of the information that people may need to know to do both their tax filing, and on the flip side of that is information about open enrollment. So a reminder of what the poverty guidelines are, of the amount of the percentage of income that people may be expected to pay by their poverty level percentage. So we all this. Because this year I think you're going to get some questions on it. The question you may be getting right now has to do with reconciliation of 2019, or I'm sorry, of 2018. And so due to COVID, on healthcare.gov and the application, there's a question asking if you have reconciled 2018 APTC. And if you say yes, then there's eventually a check with the IRS to make sure that yes, you did reconcile 2018. That check with the IRS was delayed due to COVID, but starting in September, they did do that check. So people now are getting letters that say you might lose your financial help unless you file your 2018 tax return and reconcile your credit. So people now are getting these 30-day notices that say you could have your APTC cut off right now. On top of that, consumers are also starting to get marketplace open enrollment notices. And if someone has received financial assistance in 2019, but they didn't reconcile, those MOANs will warn people that they aren't eligible for financial assistance. And so some people, if they haven't been reconciling their tax return, they may be getting letters that say they need to do both 2018 and 2019. So consumers may come to you with questions about that because the bold print really gets your attention about the possibility of losing financial assistance. And that is all I have. I'm always happy to answer questions, and I'm always happy to take your hard questions by email. We have a program called Health Reform Beyond the Basics, which is we have a lot of materials that we've developed, and we also have a webinar series. We're about halfway through our webinar series. We can see the end. It was a 9-part series that dives into income and households and immigration and all of these topics that you confront as on the ground assisters. So we're happy if you use our resources, and we're always happy to answer specific questions about cases and try to guide you through the policy. So thank you.
Thank you so much, Tara. And we do have a couple questions here that I wanted to just make sure to draw your attention to. One of the questions was asking, I think when you mentioned extended benefits, and this might have been back when you were UI, does that equal the FEMA benefit? That is the question.
No, my understanding of extended benefits is that, going a little bit out of my depth, but my understanding of the extended benefits is that it's a state benefit, and that states have set up triggers where there are certain economic conditions or unemployment conditions are reached, and these extended benefits appear to supplement what the state was already doing. And the important thing is that those benefits, extended benefits, come in after the federal assistance. And so that's why, even though the federal assistance ends at the end of December right now, who knows what's going to happen with it, there may still be some benefits that people are getting beyond the end of the year. But note that as things stand now, they're not going to continue forever. So even if someone is in open enrollment, they're getting benefits right now, they may not only have they may have a federal cutoff, but it's not necessarily going to dictate the fact that it's not necessarily going to mean that they have zero benefits in 2021. They may have some continuing benefits that go into 2021, but right now under current law, don't expect it to last for the full year. I hope that helps.
Thank you. And we have another question. This one says, if an applicant realizes in November that they reported 2020 income, that their reported 2020 income is really incorrect, is there any benefit to reporting a change that would only affect December, or should we prepare them for what reconciliation may look like, meaning caps for repayment, et cetera, not trying to forecast actual repayment?
Yeah, that's it's a really important question, and I think it varies a lot by the situation of the enrollee. So one thing to keep in mind is that if an enrollee has, if their income is lower than their projection, which could certainly be the case for some people this year, they may turn out eligible for Medicaid. And if that's the case, remember that people who go in Medicaid are protected right now by a continuous coverage requirement or continuous coverage provision. And so they will be able to stay in Medicaid until that ends. So until a month after the public health emergency ends. So that might be one option. If people have estimated too much income, if they come to you, if their income is higher than what their projection was, perhaps because of the $600 federal benefit, unemployment benefit, which was quite generous and in some cases more than people were earning, if they come to you in November, the earliest they could effectuate a change, I think it is December if they've come to you early month, or maybe not at all if they've come to you late in the month. So, whether people want to go through reporting the change in December is really going to depend on the situation. I think certainly you're going to want to look at look at 2020 income, the actual income, like maybe do a little back of the envelope calculation to help guide you for 2021, with the caveat that 2021 could be very different, and we just don't have great information about it, or don't have great information about what benefits will look like, perhaps, or the economy, jobs.
Yeah, and I think, it's just such a great, to a great extent, that's so much of what your presentation was about, was just, just talking about there's a lot of uncertainty still. And I know, and I want to say for enrollment assisters, especially those who may be newer, it can feel overwhelming, but, this is exactly the kind of reason that we do these, is just to help prepare you for what may be, what some of the experiences you may be confronted with consumers during open enrollment and then afterward, because obviously, the role for enrollment assister is not just like, okay, get them enrolled and that's it. It's obviously just to also help educate and raise awareness and assist, often in that post-enrollment situation. And I did just, we got to put a poll up. I know we were talking. That's fine. Not everybody was able to respond to that, but maybe Mike, you can put up the results of what we did see. I do want to pivot now to Karen Pollitz. And Mike, why don't you go ahead and switch presenters for that, and we can move forward. And please do continue to put in your chat questions as Karen is presenting, and then we'll address any questions towards the end.
Sorry, let me try again. Can you hear me?
Yes, we can hear you.
Let me try again. There we are. Can you hear me and can you see the slides?
Yes, I can hear you and we can see the slides.
Thank you. So I'm the technologically feeble one on this panel, but I want to thank Allison for inviting me and thank Tara for her great presentation. Tara is my go-to person whenever I have a question about enrollment rules and timelines and what to put on healthcare.gov. So I'm going to switch gears, go a little more to 30,000 feet, and just talk about a survey that my colleague Jen Tolbert and I completed this year. We were asked by the Kate Reynolds Charitable Trust. They gave us a grant to see if we could find ways to measure and document the importance of consumer assistance, which to me seemed a little bit like a no-brainer, but there actually has been a lot of talk about maybe we don't need navigators anymore. We could rely on others. Consumers have sort of learned everything there is to know and so forth. So we took out, we set out to see if we could do this. We conducted a national survey of consumers who would be eligible for, or the targets for marketplace consumer assistance. Those included people. We conducted the survey this spring. It was an online survey, and we sampled from people who had purchased a marketplace health plan, people who were covered by Medicaid, and also people who didn't have any health insurance. And among the uninsured, we asked them if they tried to get coverage or looked for coverage, or if they did not. That was the group that we looked at. The survey was conducted online in English and Spanish. A little over 2,000 were in our sample. And so what did we find? First of all, we found that about 7 million people nationwide received health insurance consumer assistance in the past year, in 2019 and early 2020. They were helped at about the same rate regardless of their demographics, which was kind of interesting. So young adults, older adults, people with very low income, higher income, different coverage status were helped at about the same rate, with one exception. We found that Hispanic individuals were somewhat more likely to get help compared to non-Hispanic whites and compared to Blacks. And that may be because of the additional concerns or challenges related to immigration concerns, language barriers, or for other reasons as well. We asked folks why they sought help. This probably won't surprise anybody. They said, you know, this can be really complicated. People were unclear about which coverage options they had, or when they had a choice of plans, how to compare and evaluate them. They had trouble kind of estimating their income and filling out applications and all of the screens that Tara just showed you. And other reasons, you know, technical problems, lacking internet, needing help in another language. We asked people about, we tried kind of breaking down the application process just to see, you know, how complicated is it? And half of all consumers said that the application process, at least some aspect of it, was difficult, whether it was creating you know, an account on healthcare.gov or reporting their income accurately, looking at their plan choices and so forth. Interestingly, people who were uninsured had more difficulties or were more likely to find this process difficult compared to marketplace, people who were signing up for marketplace plans. And interestingly, people who signed up for Medicaid were less likely to report difficulties with the process. So, okay, so we asked people then who did get help, these 7 million, you know, how helpful was it? And 9 out of 10 said this was helpful, and 4 out of 10 who got help and who were covered said that it is unlikely that they would have the coverage that they had when we surveyed them if not for the help that they received. And half said it was at least somewhat likely that they wouldn't have that coverage. So 9 out of 10 people who were covered with help really questioned whether they would have been able to get coverage if not for the help that they received. Okay, so that was a good finding. A less good finding was among people who didn't get help. We asked them, well, did you look for it? And we found about 5 million consumers who tried to get help applying for, shopping, signing up for coverage, but they couldn't get it. For a variety of reasons, they couldn't get an appointment. Maybe they waited to the last minute and all the appointments were booked. Some people could only get help remotely because of budget cuts, at least in the federal marketplace states, to navigators. You know, navigators just couldn't provide in-person assistance in more remote areas. They just didn't have the staff. And some people weren't comfortable getting help over the phone. I don't know if that's going to continue this year when I think a lot more people may need to get help over the phone, but that was something that consumers communicated to us, that, you know, they felt better kind of sitting next to somebody and getting help, and they had trouble following if it was over the phone, or they were worried that they would have trouble following if it was over the phone. So, so we have a lot of people who, you know, who wanted to get help and who couldn't find it. I think this is a reflection of certainly, you know, cuts in navigator funding in the federal marketplace states. On average, it's been about an 85% cut in funding. And also other changes adopted during the Trump administration, reducing the number of navigators available in federal marketplace states and reducing the requirement, which is now the case in some states, that the navigators don't even have to have any physical presence. presence in the state. Okay, so let me put together this 5 and 7 million together. And this finding was a little shocking for me. So when you add up the people who got help and the people who at least looked for help, that only adds up to about 30% of our target population. So only about 30% of the uninsured who were looking for coverage, or people who signed up for marketplace plans, or people who signed up for Medicaid, either got consumer assistance or at least looked for it. 7 in 10 didn't even look for help. And I think that's a troubling number. We asked the reasons why people didn't look for help. A leading reason is that they didn't think they needed help. They thought it was fairly straightforward. But 3 in 10 of these, 69% of consumers who didn't even look for help said they didn't even know where to look for help. And 1 in 5 said they didn't have time to look for help, possibly because they waited until the last minute to sign up. So we also, though, asked these folks who weren't help if they would likely have sought help if they knew that help was available in their area. And most of them said yes. 2/3 of them said yes. So even though I didn't get help, if I knew there was help in my area, I probably would have sought it out. So that suggests to me that there may be millions of consumers who aren't aware that they can get free help signing up for coverage or figuring out what their coverage options are. Okay, so let me just kind of compound that problem. Our target population, that 7 in 10 who didn't get help, that was based on, again, marketplace enrollees, Medicaid enrollees, and uninsured individuals who at least looked into getting coverage. But what we found was that 7 out of 10 uninsured individuals didn't even look into getting coverage in the past year. So I think there are millions of uninsured people who may be discouraged. They just think there's nothing out there for them, or they really don't know where to begin, or they just, don't have an idea what their options are. They just think it won't work. So I think that is a troubling situation, and something that I think we need to kind of keep an eye on as, this open enrollment and this new coverage year comes along. Look for opportunities to reach out to people who don't have coverage, and to really let them know, the messages that Tara was talking about at the beginning, that free and low cost help is available for a lot of people, and that it is really worthwhile to look into it. I think in addition to cutting funding for federal navigators, the Trump administration has also slashed the budget for marketing. The federal government, back for the 2016 open enrollment, had budgeted $100 million in marketing, in outreach funds, so that they could run ads and let people know it is open enrollment. Now's a good time to sign up for coverage. And that's been pretty much eliminated under the Trump administration. So I think investment in outreach, public education, really could make a difference, and we probably could find more people to sign up. Just kind of adding to this, we also asked the uninsured if they would enroll in Medicaid if they knew they were eligible. And most of them said, yeah, I definitely would enroll in Medicaid if I thought I were eligible. So again, very important to do outreach, especially to very low-income uninsured individuals, to see if we can find them. In other studies, we have estimated that there are more than 6 million uninsured adults and children in the U.S. Who were eligible for Medicaid or for CHIP, but not enrolled. Okay, so as I said, I think one of the justifications given for cutting funding for navigators is that it's been 10 years. America has come down the learning curve and people really know now what their coverage options are, what financial help is available, and how to apply. And our surveys, other tracking poll surveys that we've done, and this consumer assistance survey this spring found that that's not the case. Only about a third of people correctly could tell us that the Affordable Care Act is still the law. There's been a lot of talk about repeal, replace, and a lot of people they either think it's been repealed or they don't know if it's there anymore. Just under half of people correctly could tell us that open enrollment is when you sign up for marketplace plan coverage. Most people didn't know or were unsure about that. Most people didn't correctly know that Medicaid is open for enrollment year-round. Importantly, for people who live in states that did or did not expand Medicaid, most people don't know whether Medicaid has been expanded or not, whether it's even an option for them. So again, I think very important to, for you to be doing the work that you're doing and educating people and letting them know what options are there for them and helping them to connect with them. So how did consumers find help? This was something that we asked. Most people said they could give us multiple answers, but most people, or the most common answers were that they used the Find Local Help button on their marketplace website or through word of mouth. People also got help a lot or found help in Medicaid offices. Direct outreach to people who you've helped before or to new consumers. That actually reminded people, oh yeah, it's time to sign up. I should make an appointment with my assister. Earned news coverage or advertising. Some insurers engaged in paid ads during open enrollment last year. And I think many local news stations also try to, do spots saying, oh, it's open enrollment time. This year, because it's an election year, that may get overshadowed, at least at the beginning of open enrollment. So I don't know how reliable of a source that'll be for this coming year. Interestingly, social media, which I know a lot of programs rely on for outreach because, it's easy and it's inexpensive, but very few consumers told us that that's how they learned about their assister program. So another indication, I think, of the value that assisters are is that you get return customers. The most people who, 2/3 of people who said they were helped by an assister in this past year had been helped by that same person or program in prior years. So that's always a sign of confidence and I think of trust that consumers show in the assister programs that help them. Okay, so who actually helped consumers? This was a little tricky to ask about because consumer assistance programs in many states are not branded. I know Covering Wisconsin is a brand that that you use and promote in your state so that people will kind of know who your assisters are and know what they're getting, but that's not true in a lot of states. So, where we could, we asked people, if you were helped by a navigator, if it was a Wisconsin respondent, the questionnaire said, such as Covering Wisconsin. But we couldn't kind of fill in that brand in most states. We did find that people cited multiple sources of help. So sometimes they started with, the health plan directly, and then they went to a navigator, or they, started with a navigator, went to a broker, and so forth. But people do get help from multiple sources. We asked, let's see. we tried to focus in a little bit on help that people got from brokers as opposed to other marketplace certified assisters. And what we found is actually not that different from what we had found in other surveys where we surveyed consumer assisters and brokers directly. Brokers focus primarily on signing people up for marketplace coverage. That's where they get, commissions. They rarely help people who are signing up for Medicaid or who look like they may be eligible to sign up for Medicaid. We also asked folks who were helped by brokers or who signed up through one of these commercial web broker websites. For the last couple of years, the federal government has been encouraging consumers to use alternative commercial websites instead of healthcare.gov. And now they've made it possible through these enhanced direct enrollment entities, EDE sites. They've made it possible for people to actually apply for marketplace plans and subsidies on a site other than healthcare.gov. And that is supposed to give people more choices and sort of enhance the shopping experience, but it also creates some other issues because these private websites can also sell stuff that isn't marketplace plans, such as short-term policies, cancer policies, and other non-ACA compliant policies. That's supposed to be on a separate screen, but it can all kind of happen on the same website. And brokers also will, in addition to helping people sign up for marketplace plans, will sometimes sell these other non-ACA compliant products because, they make commissions from that as well. So we asked marketplace enrollees who were helped by brokers or who signed up through one of these non-healthcare.gov websites for their marketplace plans if they were offered non-ACA compliant products, either instead of or in addition to the marketplace policy. And more than 1 in 5 said yes. So I think that's just another important finding about why it is important for there to be navigators who help people on healthcare.gov, because in all of those transactions, people will only be shown marketplace policies or their Medicaid option, and they won't ever encounter these non-ACA compliant products. So I'm going to stop there. Those are the kind of top line findings from our survey, but I would just say that I think we did try very hard to document and demonstrate the importance of marketplace consumer assistance. I've known all along that the work you do is essential and really life-changing in a very meaningful and positive way for millions of consumers. So I thank you for that, and I wish you luck in this open enrollment, and I'm happy to just engage in the rest of the discussion that we're going to have for this session.
Yeah, thank you so much, Karen. That was really, really useful and interesting information. I'm so glad that you guys did that survey because I think, I know that the three of us talked about this session and what are some of the things that you all could share. And I know that we decided to close with this particular content just because we wanted to make sure people just remembered their value. I think it can feel very discouraging at times in this work. And just with how things have gone over the past few years with just reductions in funding for, as you mentioned, marketing and just the availability of things like navigators. But just to recognize that there is still definitely a value there and there's still a need. And so we wanted to make sure people knew that. We did, and actually, Mike, why don't you go ahead and share the poll question so people can answer that. While people are doing that, I did want to ask, we had a couple of questions come in that I wanted to share. One was question regarding not getting help over the phone. Was this regarding the marketplace call center, or was this any help over the phone?
Any help over the phone. So it was a little hard to kind of come up with, a menu of reasons why people might not get help, but that was one that we included because we knew already, way before the pandemic, that there had been such extensive budget cuts in Navigator programs that only remote help was going to be offered, at least in certain communities, by some Navigator programs. And so I think some people, have just a significant number of people have expressed concern about this may be too complicated. But it's hard to, I don't know what else to read into it. People may have tried the call center in the past and had a bad experience. And so they may have been reflecting that as well. But given the slide that that I showed you about sort of different elements of the shopping and application process, I think people can feel overwhelmed, and it would be helpful if they could, kind of sit alongside or at least see or have somebody else look over their shoulder and see what they're doing and, walk them through it step by step. That seems to be important to a significant number of people.
Mm-hmm. Yeah, and there's another question that, and this is specific actually to Wisconsin, but I'm curious. I'll talk about this one and then maybe just follow up with a question to you about it. So the question was asking if in Wisconsin, if a client calls 211, which is the United Way helpline, for any reason, are they still given resources and contacts for help if uninsured? So in Wisconsin, yeah, so we, covering Wisconsin especially, we regularly promote 211 as a great place and a really easy number for people to call to say, hey, I need help with health insurance or finding coverage, any number of questions. And so we work regularly with 211 to provide training to them as to how to answer that question, how to direct them, and also be on the lookout for those kinds of questions. And so, for example, this year, we are just finishing up our process of updating the connector tool, which I can talk about also a little bit later. But many of you are probably familiar with this. We've talked about it many, many times. It's kind of our, so Karen talked about the Find Local Help. That's a resource through the Centers for Medicare and Medicaid Services, CMS. The connector tool is a little bit more focused and specific and maybe more vetted is a good way to describe it. It's a way for consumers and anybody just punch in your zip code and to find assistance that's local to you. You can have a range of radiuses, it could be anywhere from like 5 miles to 100 miles. And even in this time with remote assistance, it's still useful to have somebody who's local to you, if possible. Covering Wisconsin serves anybody, so no worries there. But we just know that sometimes it can be useful to have somebody who knows the area, knows the plans, knows the providers, that kind of thing. So I guess for you, Karen, I guess one question related to that is, do you, in your work, are you familiar with just the range of what, you talked about Find Local Help, and I know that's a national resource, but in terms of 211 or other things, do we know about the range of what states, where they are in terms of consumers being able to have a central resource for finding help in their area?
As best I can tell, and I would invite Tara to jump in, there are really only a handful of the federal marketplace states that offer what you offer in Wisconsin. I think the state-run marketplaces are better. Florida is one, North Carolina is one, Indiana is one I can think of off the top of my head. In other states, though, big states, Texas, Ohio, Michigan, Illinois, no. There isn't. There just isn't. The funding cuts and other kind of state politics and other reasons have just kind of really devastated, I would say, the capacity for any kind of structured, central, strong consumer assistance program. And instead, it's some community health centers, it's some, nonprofits. They're kind of doing little things here and there. We've got, I don't know, 4 or 5 states now where the navigator that the federal government funds is just a website. It's just a slapped up website, and that's it. So, and then with respect to find local help, that's been changed a lot in the last 4 years. It's all about promoting brokers. They've got this little, new thing. Even before you get into your assister options, you can just enter your cell phone number and a broker will call you back within 30 minutes. That's the first thing you see now on Find Local Help. So they're kind of steering people in that direction. And if you say, well, no, I want an assister, they don't really make clear the difference between an assister and a broker. But if you click assister, it doesn't really distinguish the Navigator programs or the Covering Wisconsin program from everything else. So, hopefully that's something that can get kind of looked at again someday down the road. I don't know if the current administration would consider that, but, it seems like there should be where the federal government should be encouraging that kind of capacity, that kind of coordination with state consumer assistance programs, and then should be promoting it through Find Local Help, at least as aggressively as they promote help through brokers and agents.
Yeah, that's really helpful to know, just those changes that have been happening. I've been somewhat attentive to those, but I'm really glad that you brought that up to this whole audience. Excuse me. And again, I'll raise with our attendees here in Wisconsin. I think that's why there's the value of 211. Directing people there and knowing that we are much more closely connected to 211 and raising their awareness about who are the assisters in our state. And it does include some agents and brokers who are on the connector tool, but that connector tool is it's folks who have committed to saying, yes, we help anybody who contacts us. We do it at no cost. We don't charge anybody to help them. And we focus on Medicaid and Marketplace. So that, this is that group that is really looking out for the consumer. And so, folks here, if you haven't been on the connector, if you don't know what it is, check it out. You can look on our website or contact us and we can walk you through if you or your agency qualifies, which I would guess for many of you, that would be the case. If you're here, you should be there because this is how consumers can connect with you.
And Angela, I should just point out that ours was a national survey, and because we only had 2,000 respondents, we couldn't do kind of state-specific analysis. So given all of the, extensive effort that I think Wisconsin has invested, including additional state resources beyond what the little federal grant that you get, it may well be that a greater share of target consumers are being helped in Wisconsin compared to, the national average, and that the experiences are somewhat different or even more positive than they were in the national average. We just weren't able to see, from our data sample, but
yeah.
I just wanted to mention that too.
Yeah, for sure. And I'm just looking at other questions here. There is a question, again, I think there's one specific to some of the work that is done here locally, and I'll share that out. And we'll share information about the connector that I've been mentioning as a follow-up email to everybody after this session. I think the other thing that I wanted to mention, as you were talking, Karen, about just, the reduction or just lack of consumer assistance programs at a state level that are helping to coordinate that. And that is really true here in Wisconsin. I will say for attendees to know that over the past year, starting in 2019, the governor of Wisconsin put an emphasis and initiated this DHS OCI partnership. And it's focused on elevating access to healthcare and healthcare coverage. And over the past year, many stakeholders in the state have come together to really look at how can we better coordinate. So it's at the early stages, but if you're at all interested in that, there's definitely room at the table, and we encourage people to join that, and we can share out information about that as well to attendees. And I'm not seeing any other questions. The website for the connector, we can share that out. If you just go to our homepage at Covering Wisconsin, we can share that. And it looks like Mike just shared that as well. And I really just want to thank Karen and Tara for this tremendous information. It's so important. There's so much going on. And again, that value of why we're here, why we're doing this work, and to enrollment assisters out there, yes, people out there do need your help. They one, just need to know you exist. Two, they need to know that coverage is there, as some of those messages, as Tara mentioned too. Help is available and financial assistance is available. Key messages, basic messages, don't forget that. Just do that. Just, we need to get that word out. So thank you, Karen and Tara, and I will close out with just a couple of last announcements for our group. So as we've been doing the past several sessions, at the end of the day, we have a final gift card prize drawing recipient. This individual is Robin Remmel. So Robin, congratulations for that. And we will follow up with you and all the other recipients. As Mike just posted in the chat, all the slides and recordings are on the website, on the conference page. The recordings, I think, for today's will take a little while to get up, but they will be there. And as I said, we'll follow up with some information about the connector, follow up with information about the evaluation for this week. As always, we really value that information. And for those of you who are seeking the pre-licensing and continuing education credits, at this time, there is nothing more you need to do. You indicated your intent when you registered. We will pass that information along, as well as any other documentation we need about attendance to OCI. If there's anything more that OCI needs, they will follow up, or by way of Covering Wisconsin, we may be reaching out. But right now, I think all is good. So, of course, reach out to us if you have any questions or anything else that you're concerned about. So I think that's it. I think we're at the end of it today. Again, thank you so much, Karen and Tara, for being here, taking time out of your very busy schedules. This information was tremendous. I really appreciate it. And thank you all of your attendees, for sticking with us. You did it. We did it. So congratulations and good luck with open enrollment. We'll be in touch. We're here. So thank you. Bye-bye.